Brianne, thank you so much for joining us. We appreciate you taking time out of your busy schedule building communities. And thank you for joining us.
Thank you for having me.
Absolutely, absolutely. So your job is not an easy one. As someone in business development, I understand that. Would you mind telling us how you got into behavioral health and kind of what brought you into the field?
Yes, definitely. I definitely did not think this would be my career at 21 working in an adolescent residential treatment facility, but working my way up and working direct care for 8 years and then taking a leap over to business development, doing national marketing, and then now being at Aspen Grove Behavioral Hospital for the last 5 years. It's giving me insight to just see all the different dynamics of levels of care within behavioral health, as well as see all the gaps and the natural system gaps or barriers to access to care.
Absolutely, absolutely. Well, especially seeing it from multiple perspectives instead of multiple
Right.
different sides of the business. I'm sure it's much more visible.
Definitely.
Absolutely. So, what strategies have you found most effective in building those lasting partnerships in the behavioral health community?
Well, I think when it comes to community development and really building those strategic relationships, it can't be pointing at another provider saying, you should try there. Here's a number. You should check and see if they're in network with your insurance. It really has to come down to us being the resource, them calling me to say, this is what I'm looking for, and me finding that. Even if that's not Aspen Grove, finding those community providers that are the right fit. It's identifying the level of care. It's identifying the specialty needed as well as in network with their insurance, if at all costs, because the money does run out. It definitely does. So I think more than anything else, it's breaking down the barriers for providers and building that trust. And if you do that, that solidifies the partnership. It's the trust.
Absolutely.
It's them knowing that we care about their clients.
Well, and the clients knowing that you actually care about them. You're actually going to help them, not just sign them up
Definitely.
for services or shuttle them off to somebody else.
Definitely.
Yeah. So how do you keep your outreach personal and impactful in a world that often feels kind of transactional and rushed?
So I'm going to be very bold here. In behavioral health care, I believe that there is absolutely no room for transactional. We're dealing with people's lives, family, and community. And when we lead with knowing that we're doing the right thing, that we're prioritizing people over profit, that really is doing the right thing. And when you do that, everything works out.
Yeah. Yeah. How do you go about measuring success when it comes to building those community when you're not focusing on the transactional elements? How do you measure that?
Well, I think, it's the easiest to look at admissions referrals, right? But when we do that, we're missing the mark. We really have to look at, do we have these sustainable systems? Do we have these systems that are trauma-informed care as a business practice? So really, it's looking at these providers in our community and identifying the ones that are doing amazing work that really will market their specialty, right? Coming together and doing warm handoffs. Because the truth is that people fall through the cracks. Just handing a number is not enough. We need to be willing to walk the path with individuals and families to be able to get the right care they need. And at the end of the day, what I have found is that is better than any marketing strategy I've ever implemented.
Yeah. Focus on the system,
Definitely.
not just the marginal daily metrics that you might be getting.
Definitely.
Yeah, I like that. I
Definitely.
like that. What are some of the changes that you've seen in the behavioral health community since you started your career? I know it's been a long one. You've been in a lot
Right.
of different roles in a lot of different places. So what are some of the big changes
Right.
you've
Well, I think overall, I do think I've been at Aspen Grove for 5 years, just over 5 years, and truly seen there has been a shift in the industry. And it's really impactful and inspiring for me to be able to be involved with these providers that are willing to collaborate, that are willing to come together. Let's talk about the barriers in behavioral health. Let's talk about the barriers to access care and focusing on that access to care. The truth is that there are so many people in need. And the more we can actually focus on doing more preventative, the better the outcomes. Unfortunately, that's not always the case. And so it's really looking at the whole spectrum of the level of cares, right? And being able to identify the concerning behavior that goes with that and getting people to the right care. And so I think more than anything, it seems like there is this group of providers that are doing the right thing for the right reason, that are willing to focus on the people, not necessarily the profit. The profit comes with that, and we all need it to stay in business, definitely. But I do think is that the most inspiring thing is working with providers that are willing to be bold enough to stand up and say, this system isn't working. It's not in the best interest of anyone, providers, individuals, families, everyone involved. And then let's look at what the solutions are. And so it's really coming to the table with these ethical providers.
Absolutely. Absolutely. Which is not easy because everyone has conflicting needs. Even if everyone's priorities are aligned perfectly, there's still conflicting needs that are very different.
Definitely. And it's being willing to view other providers as not competition. It's identifying who we are and knowing who we are and what the population is that we serve. And when we identify that specialty, the referrals come in. The correct population that we serve, those are the ones that are being referred to us.
Yeah, absolutely. I heard a really good quote on that, and I can't remember who it was, so I'll pretend it's mine for the moment. But they said that specialization and focusing on your differentiation and communicating that well to clients is a ethical responsibility, not just a business strategy, which
Love that.
is what you said in different words, right? I think it's so
definitely. I align with that perfectly.
Exactly, because you serve people better when you're serving
the
right people that fit perfectly with your model, with what you can do.
Definitely. And Aspen Grove is not for every client, patient. We're not.
Absolutely.
And so when we're not the right fit, we have an ethical obligation to help them find the services they need in the community. And that is part of community development.
Absolutely. Absolutely. Because then people trust you. They trust that they will receive the right referrals from you at the right times.
Definitely.
Absolutely. So what inspires you most about working at that intersection of providers, families, education, and community?
I think the most inspiring aspect of the work we do is really seeing families heal, because it's really looking at it. We may not see it right away, but the impact of that family system healing goes on for generations, right? And so it's looking at behavioral health is really at the heart of our community. And when we are willing to lead with unity, with integrity, with empathy, and doing the right thing, that's what makes this work so impactful, but purposeful.
Absolutely. Absolutely. I love that. I love that. Well, thank you for coming on. Thank you for sharing some of your insights, and thank you for keeping your focus on building a community, building better partnerships.
Thank you for having me.